Hi guys, this is Dr. Veera Gupta from Optimum Health Chiropractic, and today I'm going to teach you some of the things that they're not teaching people on how to avoid COVID, or if you've had COVID, how to recover from it. Now, one of the big things that we know with COVID is that it affects your lung capacity, your ability to breathe, okay? So you need to do exercises that open up your lungs, especially if you've already had COVID and you're having difficulty walking up or down the stairs. The exercises are really easy, and it's also very important for you to get a pulse oximeter. You can get one for $10 on Amazon. They're really cheap. You should be measuring your pulse oximetry when you're lying down, you're standing, and you're seated. It might drop when you're lying down, and that tells you you're not breathing properly. If it drops when you're lying down, it's because you're not using the right muscles for breathing, whereas when you're walking, you're kind of cheating because you're circulating other things, which makes oxygen move. So let's get down to the exercises you need to know. Here's the first one, the wall angel. You have to open up your chest because your chest has the thoracic cage, which has your lungs in it. So what you want to do is you want your feet 6 inches off the wall, but you want your butt on the wall and the back of your head on the wall. If you can't get the back of your head on the wall, then just go as back as you can comfortably. The backs of my hands are on the wall, and what I'm doing without bending my elbows, I keep my hands on this wall and I go all the way up. Now, if I can only get here, and I still have my hands on the wall, then I go like this, like a little snow angel. And what this does is you'll feel a stretch in your sides and through your chest. That is the wall angel. That's going to be really, really important to open up the thoracic cage. Now, another thing that you're going to want to do is you're going to want to pec stretch, because this will also open you up. And this is a 3-part stretch. 1, 2, 3. And you hold each of these for about 30 seconds while breathing. The most important thing is you've got to learn how to breathe properly again. If you're breathing from your chest, you're not breathing right. You're not getting enough oxygen. You're not getting enough movement and flow. So what you need to do is put your hands on your waist and imagine you're wearing a belt that's too tight for you. And then breathe in and relax. Breathe in and relax. You should be using these muscles to breathe out. If this is hard, put your hands right here and just push those muscles against your hand. Do 3 sets of 10, and then try breathing in and relaxing. Now, the other thing that's very, very important for COVID, make sure you're taking vitamin D. Vitamin D is a gateway if it's not high enough for infection to go in. So while the lab range is 30 to 100, if you just get regular blood work, you really want the functional range, which is going to be anything more than at least 50 to 100, okay? So you can take vitamin D every other day. 2,000 IU is a safe dosage for small children, 5,000 for adults, and if you can eat it with a fat-soluble food, it will absorb better. So a sun butter, a nut butter, and avocado. So you've got 2 things to do. You can breathe, you can open up your chest, and you can take vitamin D, okay? And you should also see a change in your pulse oximetry if you keep doing this. This is supposed to fire 128,000 times a day, which means you're oxygenating that much more. I hope this helps you fight COVID.